in fact, we are focusing on one goal. It's ensure healthy lives and promote well-being for all at all ages, and that's also a global goal for sustainable and development goal from the United Nations. And what we want to do is to connect weak health systems with systems which are where more doctors are present. For example, in Nigeria, there's only 1 doctor per 100,000 inhabitants. And in Germany, it's around 400, and Cuba, it's 600. And this number shows that there are weaker and more fragile health systems, and these are very fragile in case when it comes to a catastrophe. Like it was happening 2014, 2015 when Ebola struck in Nigeria and leaving behind more than 11,000 deaths. And this fact is okay. And we thought about the possibility, that a test can be made on site. A blood test, for example, can be taken by a non-professional medical co-worker, for example, doesn't have to be a medical doctor. Then this sample gets analyzed, and the result, if it's not clear and impossible to be evaluated on site, can be uploaded on a server. The data can be then accessed by medical experts around the globe, and they can then evaluate the data, send it back to the doctor on site, and thereby improve the health system. That's actually the core idea of this project we initiated 1 year ago. And in terms of data security, we guarantee the highest standards, and all the data which are uploaded get anonymized. So all tattoos and all personalized data be anonymized. Unfortunately, the presentation didn't work, but in fact, that's actually the project.
Okay, well, we can do without slides. So let me just start off the discussion by asking you, Janko, I mean, your starting point, or kind of where you come from when looking at the world as it is, basically, is that I think you described it on your website as the brain drain in particular countries. We have a brain drain in the developing countries. Many medical professionals, tend to leave the country. A critic might argue that your solution, might actually accelerate that process because people do not have to be on site anymore. I mean, this is a criticism I heard, again and again, that kind of decentralized, globalized digital solutions, kind of make the problem that where we come from more stagnant or might even accelerate it. What would be your take on that?
Well, I think it can't become worse if like the number I told you, 1 doctor per 100,000 inhabitants in Nigeria and Sierra Leone, I think that it almost can't become worse. Well, if we can really do that, I mean, we cannot. If we can make the diagnosis remotely, maybe that would even maybe lead to a better health system if that becomes a normal way to analyze data. If you have like a sample preparation tool where the sample gets collected, for example, the blood test, and then the evaluation can be done anywhere in the world, I think that would be maybe also lead to a better outcome.
So what would be your vision for the future? Do you think that at some point we will have kind of global centers of research, of medical excellence, where all this laboratory work is being performed, is being done, and that, in most of the, I don't know, rural areas or less developed areas and countries, we do not have to build up these infrastructures because it will all be done remotely? Is that kind of how it will look like if we think of Africa and,
Yeah, like sample collection stations would be possible, that they can be more remotely installed, and also the machines they run quite robust, or the samples can then be transported to a bigger center where they get analyzed, and then the evaluation can be done anywhere in the world. Yeah.
I mean, we all talked about data.